Good afternoon, everybody. Thank you for joining us. This is the virtual community healthcare symposium offered by Gateway Medical Society in conjunction with Pittsburgh Black Nurses in Action. I am Dr. Rachel Toney, the current Vice President of the Executive Committee of Gateway Medical Society. I wanted to, first of all, thank our community sponsors for making this afternoon available. They include the Hines Endowments, UPMC, Highmark, and Highmark Whole Care, as well as several community organizations that I know you are aware of: the Ivy Charitable Endowment of Pittsburgh Incorporated, Pittsburgh Black Nurses in Action, Chi Eta Phi Sorority Incorporated, the Faith-Based Health Collaborative, the Links Incorporated, and the Alpha Alpha Omega chapter of AKA Sorority Incorporated. So we have a very wonderful discussion with our panelists this afternoon to discuss the COVID-19 pandemic and domestic violence, trauma, and impact on children and our youth. I also want to introduce to you our moderator this afternoon, Ruth Wilson. She is a registered nurse who has been working with UPMC healthcare system for 19 years. Her area of specialty is oncology medicine. She's also an active member of the National Black Nurses Association and the local chapter of Pittsburgh Black Nurses in Action, where she is currently the recording secretary. She also serves on the health policy and community outreach committees. She is passionate health advocate for the community. She's also a certified YMCA fitness instructor, has led several church health ministries and facilitated healthy community initiatives for the past 17 years. She is an Allegheny County resident and shares 3 school-aged children with her husband of 18 years. Ruth, thank you so much for joining us this afternoon.
Thank you. Hello. Today we have a very important conversation and discussion, and we will be talking about, as Dr. Toney said, about the COVID-19 impact and domestic violence and the trauma that our children and youth have experienced from it. We have 3 experts who are going to share their expertise. I will tell you about them. Just for housekeeping, all attendees, you are muted. You can enter any questions you have into our chat box, and we will get to that after the presentation. Domestic violence, 1 in 3 women and 1 in 4 men have experienced some form of intimate partner violence. And this is according to the National Coalition Against Domestic Violence. So this is something that if you have not personally experienced, someone that you know has experienced this. I will tell you about our experts today. Barbara Crosby, she is a retired nurse whose areas of nursing specialties include medical surgical, radiology, home care, school nurse, mental health, forensic nurse at the Allegheny County Jail. She retired from the Western Pennsylvania School for the Blind. Barbara has kept her nursing license current to continue community work in mental health first aid for adults and children. She also works as a COVID-19 vaccinator with Bethany Ministries. Barbara is an ordained deacon at the Great Historical Ebenezer Missionary Baptist Church under the leadership of Reverend Dr. Vincent K. Campbell. She has 2 daughters, 4 grandchildren, and 6 great-grandchildren. Next, we have Dante Works. He is the owner of the House of Veterans, and he is a Mad Dads member. Mr. Works received his Bachelor of Science in Criminal Justice, May of 2001, from Virginia State University in Petersburg, Virginia. He was an adult parole probation supervisor at the Allegheny County Court of Common Plea in Pittsburgh, Pennsylvania. His leadership involvement and recognitions include being a fabulous under 40 recipient, Men of Excellence recipient, and serving as Vice President of Safe Race Street Committee. He also received a certificate of ordination from Covenant Church of Pittsburgh. Dante founded the House of Veterans in 2017 to assist veterans who battle homelessness and addiction. Veterans that have a sincere desire and commitment to recovery can change their lives for the better when provided a solid foundation on which to rebuild. Through their hard work, various resources, strong community partnerships, and dedicated professionals, these individuals can move beyond their troubled past towards a stable, sober, and productive lifestyle. Next, we have Dr. Maya Raghavan, and she said we can call her Dr. Maya, as her patients call her. Dr. Maya Raghavan is an assistant professor of pediatrics at the University of Pittsburgh and the UPMC Children's Hospital of Pittsburgh. She is a mixed methods community partner researcher whose work focuses on dating and domestic violence prevention, COVID-19 vaccine equity, and language justice. Throughout the COVID-19 pandemic, she has been examining the impact of domestic violence survivors, as well as advocates and agencies who support them. So we will start off with a presentation from Dr. Maya.
Hi, thank you. Sorry, excuse me. Thank you so much. I'm so thrilled and honored and humbled to be here and to talk a little bit about a really, really challenging but important, powerful topic, which is supporting survivors of domestic violence. And so I'm just going to share my screen quickly. So I always like to start by just taking a moment and acknowledging that this is an incredibly challenging topic. As Ruth shared, so many folks have experienced domestic violence. Either you've experienced it yourself, you have friends or family, loved ones who've experienced it, you may know somebody in your life, and this can be really hard to talk about. And I really think it's important to just take a moment and breathe. And I always like to say, if anything that I'm saying is at all, I just want you to just know if and when you need to take a moment, take a pause, mute yourself, turn off your video, do whatever you need to do to feel okay during this conversation, because while it's an important one, it's a really challenging one as well. And so whenever we talk about intimate partner violence, I like to start with the fundamental fact that it is rooted in power and control. And so much of intimate partner violence, the way that we see it show up, is related to someone using power and control against somebody else in an intimate relationship. And so often I think when people think about intimate partner violence or domestic violence, they think about physical abuse, which is common and it's important to think about. But I have seen, and I'm sure we all have seen, this manifest in so many different ways. And so, you can see it show up through immigration related abuse, where somebody may threaten to call ICE or threaten someone's immigration status, financial abuse, where someone may try to ruin someone else's credit. You can see it show up through using children, which I see all the time. And I think that there's so many different ways that it can show up. And so often I think folks are not believed, or the multiple ways that power and control shows up are not always acknowledged, not always recognized. So I think I just want to start by saying it's very much rooted in power and control. And I think the other really important thing about IPV, about intimate partner violence, domestic violence, is I think so often it is considered something that happens at kind of the individual or interpersonal level. But so much of IPV happens because of structural inequities and because of policies and practices that are rooted in racism, that are rooted in xenophobia. So I just gave the example of immigration-related abuse, which is a really common type of abuse, unfortunately. And the only reason that people can use someone's immigration status against them is because of the xenophobic and racist policies and practices in the United States. And so I think that that's one of many examples of the ways that so much of IPV happens because of structural level inequities. And I think it's really important to remember that and think about that as we're thinking about, about supporting survivors of intimate partner violence. One of the things that I hear all the time from folks is, well, why didn't this person just leave? Why didn't this person just leave? And I think so much of it is shifting away from why did the person, thinking about why did the person leave the relationship, didn't leave the relationship, to how can we support that person with what are their priorities, their needs, their hopes, their dreams? How can we really support them? The other thing I want to mention is, while I'm going to be talking about intimate partner violence, which is violence and control and coercion that happens at the intimate partner relationship level, so much of intimate partner violence is interwoven with other types of violence. So whether it's community violence, societal violence, through racism, through xenophobia, through language injustice, through poverty, we see all these things really interwoven. And so I think it's really hard to say, well, we're just going to focus on this or just focus on this. And I think this is especially important due to the rise of gun violence and all the ways that's affecting children and families that I sort of mentioned that. So while I'm focused on intimate partner violence, I do want to also mention that many different types of violence are related to each other. And like I said, IPV is rooted in power and control. And so like so many things, the COVID-19 pandemic really laid this all to bear and showed us the ways that IPV power and control can manifest. And so a lot of what we've seen, and I'm sure, folks that are doing this work have seen, folks that are supporting survivors have seen, I've seen through the work that I've done, is that COVID-19 has really been used to control and manipulate survivors and their children. And so I have, so many examples of this, but, I'll just name a few. So things that we've heard, that we've seen. So for example, abusive partners taking stimulus checks. When courts were delayed, like for example, when immigration court was delayed, using that as a way to try to continue to control because people weren't able to get U visas or they weren't able to go to immigration court. One of the things that we've seen, a lot, and I've heard a lot as a pediatrician, is using using children. So children are constantly being used, I think, by abusive partners as a controlling mechanism. And with the COVID-19 pandemic, that happened even more. And so I think I have a quote here. So this is an example that an IPV advocate was sharing. So this person said, when COVID hit as hard as it did, the abuser was saying that they weren't comfortable exchanging the children on the weekends anymore. So she wasn't able to see her children except by FaceTime. She has started seeing her children now, but for longer, at least for a couple of months, she wasn't able to see her children at all. And so that's one example of the ways that abusive partners were using the pandemic. One other sort of example that we heard a lot of in some of the research that I was doing was cutting off cell phone service. And so, during the pandemic, particularly at the beginning of the pandemic, really our only connection to people when we were doing physical distancing was through our phones, was through internet, was through being able to communicate that way through text and social media. And I've heard of a lot of folks where the abusive partner, especially if they were the ones paying for cell phone bills, would actually cut off that service to really isolate folks. So just a couple of examples of how this has shown up during COVID. I do also want to include this quote. A lot of what we heard, while we heard a lot of examples of, the way that the COVID-19 pandemic was impacting survivors, we also heard a lot about resiliency. And so I just wanted to show this quote as well. And so I want to just move now to how can you help someone you care about who's experiencing IPV? And this is something that maybe we've all needed to do before, that we're thinking about, now if we know someone in our lives who's going through something like this. And I think the most important thing is to listen and be supportive. And I will say, when I've had friends or family members or patients or families talk to me about relationships I thought were unsafe, that even though I've been doing this work for a while, that's not the first thing that came to my mind. The first thing that came to my mind was like, oh my God, I need to get you out of this relationship. I'm really, and that's the first thing that comes to our minds, because we love these people, we care about these people, we want them to be safe. And that's always what comes to my mind first. And I think it's taking that pause and that breath and just listening and hearing what's going on and hearing that story. And I think when people have done research about what IPV survivors want from support people, it's always listening, it's always supporting them, and it's always making sure that whatever plan happens, it's they're leading the plan. If we try to, this is something I always have to remember, if I try to fix, quote unquote, fix the problem, I'm taking control away from them, and control has already been taken away from them. So my responsibility is to try to put control back in their hands and let them guide what happens next. So like I said, listen, be supportive. Your first reaction may be anger, frustration, disbelief. But really listening is really, really critical. And then here's something you can say, I think, and it's helpful to know what you're going to say, because then you can make sure that you're validating sort of folks. So I often will say it's not your fault. I thank people for trusting me with their story. Even, I've had very, very close friends who I've known forever, who have then shared many, years into our friendship what was going on. And, I think it's so hard to open up about these kinds of things. And so I always try to thank people for trusting me with their story, really telling them, I'm so glad you told me, I'm always here for you, and that you don't deserve this, you deserve to be treated with respect. I also think it's really important, to not feel like we have to be the expert in this, like that we have to be the ones that know all the answers, because this is so complicated and it's so challenging. And so that's why it's so important to know that there are resources available to help, which I'll go through in a moment. It can be helpful to help with a safety plan. And so I don't love the term safety plan. I think it's better maybe to call it a support plan. And really what the support plan is how do you support the IPV survivor and their children in a way that makes sense for them. And so every situation is a little bit different, and the places that are safe and supportive are different. The people that are safe and supportive are different. So I think it's really important to kind of sit down and think through, okay, for your situation, what is a good support plan for you? Some of the things that you can do is plan safe word or phrases. So when I have families that I'm working with where I know that there is IPV, sometimes I'll have a code word with them. So then if I know they say that, I know they're not in a safe environment. I think this is particularly important since we do so much more work through phones, through, so many more conversations through phones, through texting. So I think it's important you can have a safe word or phrase. It is really helpful to suggest that people make copies of important documents, in case they need to leave quickly as well. I do want to share some of the resources. We're really, we're so blessed and lucky in Pennsylvania to have, or in Pittsburgh and Pennsylvania to have a lot of amazing domestic violence agencies that can help support families. And so the Women's Center and Shelter is here in Pittsburgh, Center for Victims as well, Crisis Center North, the Ali Kiski Hope Center, Pittsburgh Action Against Rape. And what's so amazing about these organizations is so often I think people think of these organizations as emergency shelter, and many of them do have emergency shelter, but they also have people that are experts in IPV who can really walk folks through the process of, okay, what are the ways that we can get you connected to counseling? What are the ways we can get your kids connected to counseling? What are the ways that we can make sure that you have the legal resources you need? All of those different pieces. And so whenever I'm offering resources or supports for folks, I always try to let them guide what they need. And so I ask them, okay, what are the things that you need? What are the things that I can help you with? And then try to guide people that way. I also wanted to share the National Domestic Violence Hotline and the National Teen Dating Violence Hotline, both of which are national hotlines as well. And so I've mentioned this before, but really important to follow a survivor's lead in how they'd like to proceed. And I want to take a pause. I know that this is about children, and I've focused a lot on adult IPV survivors. We've seen a lot of adolescents and young people experiencing abuse and violence and coercion in their own relationships. And so a lot of these suggestions, these strategies can also work, can also be helpful if you have a young person in your life who's experiencing violence. And I think also when we think about children, we know that so much of child health is linked with parent health. A parent and children are inextricably linked. That's a bond that can never be broken. And so in my mind as a pediatrician, I think it's really a detriment to, I think sometimes I see, very well-meaning pediatricians really focusing on the kid. And I think that's so important. And we need to focus on the parents. We need to focus on the families, because that is such an important piece of all of this. So in my mind, when we are supporting the IPV survivor, an adult IPV survivor, we're also supporting their children. And then I think the other piece I like to mention is about resource sharing. So it's also really important to follow the survivor's lead when it comes to how they want to proceed. So I've talked to so many folks, and some of them want to be connected right away to the Women's Center. Some people want to think about it. They don't want to be connected right away. They feel like it's just not the right time for them. They may not be in the right place. They may not feel like they are in a safe situation to do that. They may just not want to and don't need to give you a reason for why they don't. And so then I really just try to say, okay, I'm always here and available to talk, but I never try to push people to access resources unless they feel like it's what they want. So much of, I think, what it is to support an IPV survivor is to try to make sure that control is in their hands, that they're the ones leading the conversation. And so these are the numbers for the Women's Center and Shelter as well. They also have a text line, they have a chat line, and they also have a multilingual line and have advocates there who speak different languages. And this is information about PAR, or Pittsburgh Action Against Rape. And so they are so incredible. If you know someone who's experienced sexual assault, rape, trafficking, they do incredible work to support survivors as well. And so, I've said this again, it's really important to connect people with local community-based agencies. If you are outside of the Pittsburgh area, the Pennsylvania Coalition Against Domestic Violence actually can help people find their local domestic violence program. And so I think that can be really helpful as well. And, I think it's so important, like, again, if you feel like you don't have the answers that someone may need, to know that there is help and experts available, resources available. Often as a pediatrician, I don't have all the answers. People will ask me questions and I don't know. And I think it's so important to just make sure that we're connecting, to all of these incredible resources that are available. The one other thing I like to mention is it can be such hard work supporting an IPV survivor. Healing and trauma happen concurrently. They happen over a long period of time. They happen at the individual level, the community level. And so I think so often, when I talk to my colleagues, they think that, okay, I'm going to give someone the number to a domestic violence agency. They're going to call. It's going to be great. It's going to be over, and we're going to move on. We're going to heal. That's just not how it works. That's not how healing happens. And I think it's so important to know when you are feeling fatigued and if when you need to take a step back. And that doesn't mean that you are not a caring and deeply empathetic person. It just means you need to take a moment for yourself as you continue to support the people in your life. I think this will only take a minute, and then I will move on. I do like to just share a little bit for parents and caregivers. So this is on a little bit of it's a related but slightly separate topic. How do you talk to your kids about dating violence? So we know that forming healthy relationships in adolescence is so critical to supporting folks across the lifespan and having healthy relationships. So I just wanted to provide some suggestions and tips. And so we know that parents play such an important role in protecting children against dating violence. And I don't think it's ever too soon to start talking to your kids about healthy relationships. So just some general ideas. So this is a hard conversation to have with your children because children often do not want to talk to their parents. Adolescents don't want to talk to their parents about dating violence, dating relationships. That's the last thing they want to talk to you about. And so what I recommend doing is try to include these conversations, in everyday things that you do together. So if you're watching TV, watching a YouTube video, reading a book together, just whatever you guys, usually do together, or even if you're silently there while they're engaged with some kind of media. If you see a relationship on TV, for example, that's either healthy or unhealthy, point it out, ask them what they think about it. That's a really good way to start the conversation. I think it's important to talk about respecting what friends and what a healthy friendship is like. And that's something you can start early on, even like 5, 6, 7, you can start talking about what friends are like and how to be respectful to your friends. I think it's really important to focus on gender inclusivity, and then lots of conversations around social media, which we can talk about more if anybody's interested. So for younger children, I recommend starting with, what does it mean to be a good friend? What do we do when we're angry with our friends? And then talking about good and bad touch and consent can start really early on. For middle school students, that's when I recommend starting to talk about dating. So I always say, start with like what friends are doing. What are your friends doing? Are they going out on dates? I will say that I have been told multiple times that because I use the word dating, I'm old, which is, great for me to know. But, I think even the words dating, that all has changed so much. And so asking them what it looks like to them, I think can start a really nice conversation. You can ask, how do you decide if you like someone or want to go out with someone, want to talk with someone, want to text with someone? And then what should family rules be around dating violence? Every family is different. Every family has rules around dating violence, curfews, all those kinds of things. Having those conversations early can be helpful. And then for older children, older teenagers, talking about what would you do if your friend was in an unhealthy relationship. And then this is something that gets missed a lot, but how do you break up? If your kid wants to end a relationship, how do you do that in a healthy way? That's really important as well. So that is the end of my presentation. I'm really excited to have more of an in-depth conversation. I do want to just take another moment and say, this is really difficult. Thank you for being here, for listening, for engaging. And I will stop sharing my screen.
Thank you, Dr. Maya. I just wanted to encourage everyone who is attending to please enter any questions you have into our chat box. Also, this is being recorded, so you can go back at a later time and look on the Gateway Medical Society site, and you'll be able to retrieve this information. That was very helpful. The COVID-19 pandemic hit us very hard since March of 2020. That's 2 years. So with the uncertainty and the health risk, it was very important that we had to isolate and quarantine from being around others. And a lot of families who were used to going out into schools and to work settings were forced to be at home at longer periods of time. Dr. Maya, do you feel like there was a correlation between being home longer with an increase in domestic violence?
Yeah, that's a really great question. And so there's been a lot of research on this topic, and overall, it does look like there was an increase in domestic violence during the pandemic, particularly the sort of earlier stages. But I'll say that there's a lot of limitations to that work, and I'm not really sure that we know, because not a lot of the research and stuff relies on police reports, and we know that a lot of domestic violence, does not get reported to the police. That domestic violence looks like lots of different things, and so I think while there likely was a rise, I think what I find so important too is just looking at the ways that the COVID-19 pandemic led to power and control sort of differences, the ways that power and control showed up during the pandemic. And I really think, like, in the future, if we were ever have a pandemic again, or as we're like continuing with this pandemic, how can we include gender-based violence, domestic violence, sort of in emergency preparedness planning? How can we make sure that if this happens again, that we can ensure that everyone is well and thriving, if we need to go into sort of the shelter in place again. And so I think that's really important for the future.
Thank you. This next question is for Dante and Barb. You both are very active in our communities with the youth and with adults. Have you noticed a higher trend of trauma or domestic violence?
I have. And the population that has been really affected negatively are the ones that was vulnerable in the beginning, like our youth, our LGBTQ population, our families that live in rural areas. They have been, isolated. And it's just been a traumatic situation for groups who have already suffered a lot of emotional trauma. And within our neighborhoods, there is shootings every day. And children, even before the pandemic, they were asked to, after being up all evening with trauma in the streets, they were asked to come into the classroom, be quiet, have a seat, and learn. And that was real difficult, even before the pandemic. But I also think that teachers, they need to have trauma-informed training so that they don't look at our children as bad or try to give them a diagnosis, ADHD. They need to understand the therapeutics of what's going on with them. And I know that's difficult, but that needs to be done.
Thank you. Dante?
Yeah, I would agree with Ms. Crosby in saying that the violence had existed prior to COVID. Personally, and this is just my personal opinion, I believe the way the society and community managed COVID was what kind of added to the increase in trauma and violence and domestic relationship. I believe COVID was an opportunity to slow life down and require families to spend more time together and be more creative in relationship building. However, the social media and the news and those guys, to make it more attractive, they had to put a spin to it, a negative spin to it, as if we were trapped in our homes, and all of these elements are going to start to boil in our homes. But I believe if it was managed well and understood in the time that it happened, it was an opportunity to build relationship and kind of just take a step out of life and appreciate your siblings, your wife, your spouse, your children, normal thing, not normal, but being creative, walking the parks, playing outside again, and get away from the cell phones and the technology that has added a lot of perversion to our life.
Thank you. Dr. Maya, did you have anything else to add?
No, I totally agree with what was said. Yeah.
And this question is actually for the three of you. What are signs of trauma in youth and in adults who have been victims to domestic violence?
I know I've seen little children who are very anxious to the point that therapy is required. And I know of a case specifically. Now he had an older brother and a younger sister, but that wasn't enough to, to keep him from getting the anxiety and, and so what his parents had to do was to get him a puppy. And that was therapy for him, his own responsibility to take care of the puppy. So that worked for him. But there's a lot that do not have that option.
Are there any other symptoms that either of you have noticed in the community of signs of violence, domestic violence, intimate partner violence?
Dante, do you want to go first, and then I can name a couple after?
I'll let you go first.
Okay, all right. Yeah, I agree with Ms. Crosby that it can look like so many different things. I've seen, stomach pain, headaches, pulling out hair, depression, anxiety. You also see kind of, a lot of anxiety around, how, whether a parent is going to be okay, and trying to make sure that, the parent is okay. I've seen, and then there's other pieces. So this is looking at more like adolescent relationship abuse, but we found things like, increased things like truancy. So not going to school. And that's where it's like, I think it's so important. So many of the systems are so punitive, like truancy, for example. It can be very punitive, but maybe, they're experiencing, we've seen high rates of things like employment or education related interference, where a partner may say, oh, cut class, do this, do that. Maybe that's the reason behind it. So I think it's like, there's so many different ways that it can show up. There's so many ways it can look like that I've seen. Those are just a few examples. And I think it's just so important that I just work. Yeah, like I think Miss Crosby, you said this, I worry so much about children being labeled, children being told that they're not doing something right. Why aren't you going to school? Rather than thinking like, what's going on? How can I support you? How can I focus on your strengths and get you where and help you get to where you need to be, rather than like, why aren't you going to school? So just a thought.
Thank you.
Yeah, I mean, from my observation is just, and interacting with the youth. We just recently met dads. We had a mentor group for 6 weeks, and some exercises we did was allow to youth to draw a mask of what a mask they would like to wear to an event. And after they drew the mask, on the back they would draw 3 issues or concerns with social disorders, or just things that they struggle with. And the masks, they were funny, they were exciting, they showed a lot of expression. However, the things behind the mask was really what the child was struggling with. And you've seen a lot of anxiety and trust issues. And I think one of the big ones was depression. And so, I think when you're building those relationships, those things kind of unmask themselves as the student or youth begins to trust the peer or the mentor, and it just comes out if you're paying attention, in different activities and allowing them to talk. and express themselves.
Mhm.
Thank you.
Can I say, Ruth, that I love what Mr. Works, Dante does. That group models, and some of our children don't have models and mentors, and they give up their time and support young people in those areas. And it's been effective.
Thank you.
Yes, thank you for what you do. So what are ways that we can further support them? So you brought up something very valuable about listening to them, having a relationship with them, mentoring them. What are other ways that we can support our youth?
I think once what we've learned is if the youth knows you care about them, they'll pretty much do anything for you. And so what we've seen in young men, when you talk about nature versus nurture, we've seen that I would say all young men have a place in their lives for a male to express love to them. That place has been voided since birth in a lot of these young men. 75% of long-term incarcerated men come from a fatherless home. 85% of rapists who were motivated by displaced anger come from a fatherless home. And so when we're dealing with the community, and more specific, the Black community, the fatherless home, I believe, is the root of a lot of this pain and behavior issues, because there's no longer a male in the house, and not just a male, but a man. There's a scripture where it talks about God looked out amongst the males looking for a man to stand in the gap, and he couldn't find one. And so when you look in the community now, there's plenty of males. They're on the football field, they're on the basketball court, but we need men of character and content to stand in the gap, who are implementing and investing healthy relationships to the young men, to break a lot of these generational curses, and to help them be better than we were when we were young men, and not just recycling and saying, bring the old such and such back. So, if you tap into the vacant outlet of maleness and masculinity love, I think, you'll be successful when mentoring young men.
Thank you. And I'm going to tap you again for another question, since you have a lot of experience. And do you believe that domestic violence offenders can change, and is there support for them?
Absolutely. As a former parole officer, Allegheny County, we partner with the Women's Agency, and we provided DAC classes, domestic abuse classes. And I believe anyone can change when given the proper tools and support, and then a desire to want to change. A lot of domestic abuse that we've seen in the criminal justice system is inherited. It's observed as a youth. It's observed in the music, the social media, the TikToks. And so it's all, in most cases, learned behavior. But what's been effective and what I've seen in some of the DAC classes is, men holding other men accountable for their behavior and not co-signing their behavior and actually telling them you're wrong. A lot of times in the Black community, it's hard to tell another Black man they're wrong because we want to support each other, but accountability is okay. And so when we're able to hold men accountable for their behavior and say it's not okay, even young men, you'll get a lot of men to say, hey, I guess I am wrong because not everyone's doing what I'm doing, and they're holding me accountable for my behavior.
Thank you. Did you have anything to add, Barbara or Dr. Maya, to that question?
Yes, I think they have to admit what they did was wrong. And then they have to take responsibility for what they did. And to recognize that abuse is a choice. You choose to do. You may see it merit, but it is a choice, and you can choose not to do it. You can learn to choose not to do it.
Thank you. And Dr. Maya, I have a question for you. Dante brought up a good point about the impact that social media has. What advice would you give to parents as far as educating their kids about social media, and what boundaries should parents put in place?
Yeah, that's such a great question. And I think it's such a complex answer. I do think it's really important first for parents to understand social media themselves. And so I'm right at the intersection between, like, when I was in high school, or not even high school, like when I was a young adult, Facebook was the only type of social media. So I'm at that generation. And I've got to say, it has taken me some time. I've spent a lot of time trying to understand social media myself, because it changes so rapidly. And that has been helpful for me. So I think it's important to start with knowing social media yourself. And there are some great social media literacy programs for parents to look at, because I think, like, unless you're on social media or understand it, it's hard to even understand what it is. And I sort of think that's a way that the kids are keeping us off of it, keeping us out of their business, is by changing social media every 5 seconds. So I think that's really important. And then I think, observing and understanding what your kids are doing and looking at. And like I said, like, if you see things on social media, like Mr. Works was saying, like, there's so stuff on social media that depicts an unhealthy relationship or toxic masculinity, to really point it out and ask, hey, like, what is this? What do you think about this? Like, what does this look like? How do you feel about this? Because there is a lot of that on social media. Or reversely, if there's something on social media that really shows what a healthy, strong relationship looks like, point that out as well. And then I do think for, like, the younger, as kids are getting into social media, it's also really important to just be aware of things like online, relationships. Like, I've seen a lot over the pandemic of young people that are in these relationships with people online, and who knows how old they are, or who they are, or what they're doing. And so I've tried to kind of suggest to parents that they learn, about social media, and then go through some social media literacy courses with programs with their kids. There's some good ones online that you can do to make sure that their kids are also understanding, what these sort of online predators, type of things can look like too. So that's just the beginning of an answer. I'd be curious what other people think. I think it's really, really, really hard, but I think really the first step is at least trying to understand it yourself. And if anything, when you try to understand it yourself, your kids will start making fun of you, but at least they'll talk to you about it, because you won't get it right. But at least they'll talk to you. Like, in my mind, I'd rather have my kid make fun of me, but at least they're talking to me. And I would rather get everything wrong, but, like, having that conversation is so important. So yeah.
And did you two have anything to add for social media? Yeah. All right. So for our next question, what do you do if you think a child is being abused, or you think that their parents are being abused? For example, there was a student who a close friend of his told him that the friend's father tried to shoot the mother. So the friend comes home, tells his family this scenario. What should that family do? They don't want to, they were apprehensive to report this because they didn't know if it was true. They didn't want to cause problems, but what should they do?
I've always operated as a mandated reporter. I tell people that I meet that, I'm going to tell. And, no matter the situation, we have to report issues and concerns to the proper people. I mean, I try to come up with a plan with someone before I tell, so that after we tell, there's a plan of implementation to a better place. But outside of that, I just think we have a responsibility for reporting behavior that is against the law or illegal or puts someone's life in danger.
Thank you. Any other?
Yeah, this is something we run into. I think, like, I'm sure Miss Crosby and Mr. Works, what I run into all the time as a pediatrician, and it is so complex. And I have spent hours and hours and hours thinking about it, because on the one hand, I'm a mandated reporter, and if the child is experiencing abuse, I have to report. And I also know when it comes to IPB, the ways that that report could lead to escalation in abuse. It could lead to involvement of the child welfare system. It could lead to, I've seen folks, call CPS as a controlling mechanism because kids are used as a controlling mechanism. So it's like that both and. So I really agree with what Mr. Works said, that like really thinking about a plan, a support plan, making sure that, whenever possible, like if you can actually have the IPV survivor do the report, because like at least that's putting control in their hands again, that's one suggestion. Coming up with support plans. The Women's Center has a specialist in the CPS system who can be really helpful for IPV survivors navigating that system. All of those things can be really helpful, I think, but it's one of those things that it's like, it's kind of that both and of like, yes, and really making sure. Futures Without Violence, which is a national violence prevention organization, has this phrase that they say, moving from mandatory reporting to mandatory supporting. And so I think it's kind of this idea, if you need to report, you also support.
Right.
I love that.
And you know what, Bruce, and this is good for us adults that we're talking about, but on the street, kids will not tell. I know a young man who was shot 6 times. They have it on the video. They have had, in fact, the guy who did the shooting is in prison, not in prison, but downtown at the county jail. He will not tell on him because of fear that it's going to be problems with his family, because his family still lives up in that area. And so it's a real tough situation.
That is, it's something how fear just really permeates through everything for victims and those of us who are trying to support victims. We have another question in the chat, and it says, several years I attended a meeting where the topic included how to help decrease truancy and poor school performance. There was a program in California. Every school day, the class sat in a circle for a few minutes and everyone had a chance to say briefly what may have been a challenge for students. I didn't, and for example would be, I didn't eat last night, there were gunshots in my neighborhood. With this, the students started to improve academically and truancy decreased greatly. Have you heard of any programs like this? Have any of you heard of anything like that? No.
That sounds like a NAAA model type of activity. In our youth group, we've done in the beginning, we call it Thorns and Roses, where the students were able to express their week, whether there was a rose or a good experience or a thorn, a bad experience. And the reason I did that was to allow them to see that they are the only ones dealing with certain issues, and that someone sitting across from them or next to them, or even myself, have experienced some of those thorns and roses. So I think the activity kind of, it allows people to feel like they're not alone and there's another me too in the room who's experiencing those thorns and roses. So I've seen it work in that capacity.
Thank you. We have another question. It says, and this is for you, Mr. Works. It says, can you tell us a little more about the Mad Dads organization and how can we get children involved in some of their programming activities?
Absolutely. So Mad Dads, we have a Pittsburgh chapter. There's chapters throughout the United States. I actually serve as the vice president of the Pittsburgh chapter. We just recently started a Mad Dads mentoring program where we took 5 young men for 6 weeks Saturday morning, and we discussed topics such as financial wealth and health, conflict resolution, relationship, healthy relationships, compliance with authority. And initially we started the program with a curriculum and a plan, but as the students began to get comfortable and build relationship, the organic conversations began to happen with the more real issues that they're dealing with. So that was our first group of 6 weeks. It was grade 9 through 12. We're going to do another group. It's going to be grade 6 through 8. We have a website, Mad Dads, Pittsburgh, I think PittsburghMadDads.org. And you'll see us in the community. We're an organization that we like to be consistent in our community relationship. We don't want to show up after a tragedy or after a shooting. We show up weekly in certain communities so that we are there before and after if there was a tragedy, but we want to be more proactive. And so we have a mothers chapter of Mad Dads where we have mothers who attend meetings monthly. And so we just serve the community. We go to different high schools during lunch periods and have a male presence. A lot of people don't know in officer training, one of the first steps to compliance is officer presence. And that means the officer's presence should eliminate the issue. And so if we have a man presence and multiple males, we've seen that in high schools, the lunch periods pretty much go a lot smoother than they've gone when there are men in the building. And so we do a lot of community activities, but you can check us out on our website, and I'll leave my number in the chat if anyone wants more detail about our organization and or want to join. We're looking for men and women to get involved so that they don't have to wait till it's their child on the street, and we can do something before it gets to that level of violence.
Thank you. And that was one of our questions, is what can we do to prevent this violence, not only the intimate partner violence, but like Dr. Maya said, we've seen violence against immigrants. And even with COVID-19, there were students who reported, even in high school, that some of their classmates were calling them racial slurs or calling them the, different names for the COVID-19 pandemic. So thank you. What can we do also to support people who are victims of domestic violence and they don't realize it? For instance, young men who may think they can't be a victim, or someone who's a victim of intimate partner violence who they may not be physically harmed, but like Dr. Maya said, it could be control, it could be financial, it could be controlling who they talk to and where they go.
I think education and influence, influence over authority when you're dealing with the youth, and just kind of, I'm just big on relationship. Once you establish that relationship, the youth will begin to be transparent and vulnerable in your presence. And so I don't think they want to continue to hold those hurts and trauma. They want to release it, but they want someone to trust who's going to be able to relieve them of it and not necessarily just hanging on a clothesline. So I think it's important that the relationship is established to help allowing them to open up and be transparent.
Thank you.
I've also seen it in women's shelter. They are prone to talk about it in a safe environment.
Thank you.
Yeah, I mean, I totally agree. And I think part of it is, we all, whether it's through our job, professionally, if we meet someone's experiencing IPV, personally, whether it's a loved one or a patient or a client you're working with, like we don't want that to happen. We love this person, we care about this person. And I think it's so hard to just remember to start with the listening and really try to, I think saying things like, that's not okay, the way that they're treating you, like really calling it out, acknowledging it, not in a judgmental way, just in a, hey, I'm calling out that this person who's destroyed your credit, that's not an okay thing that person did. And maybe that's the first time someone, even realized like, oh, it's not okay that person destroyed my credit, or it's not okay that person took my stimulus check or something. So I think that can be really helpful, and recognizing that it's not, I think I said this, like, it's not always like a one-time conversation, like Mr. Works said, like it's that relationship. And sometimes it's not until many conversations where somebody says, I'm ready to talk to you about this. I want to talk to you. So it's, yeah.
And I want to add that the biggest tool we have is our own experience in trauma and abuse. I believe your testimony will allow other people to allow you into their lives once you can say me too. A lot of times we want to help them, but not share our testimony, and so they feel like they're alone. But once you're able to be transparent yourself and say, hey, I've been there, and a lot of people, youth are comfortable saying, oh, you too, and then that relationship starts to build. So a lot of times through our pain and suffering, those are the reasons we've done it, so we can experience and help someone else who is experiencing it get through their issues.
And I agree in the fact that we can't look at the children that are at risk like those are those children. We have to look at them as our children.
Thank you. Thank you all for sharing and for this great discussion. We are going to turn this over to Joanne Boyd, who leads the health policy for Pittsburgh Black Nurses in Action. Thank you.
Thank you. Thank you, Ruth, and our panelists. You guys were absolutely fabulous. This was great discussions. We got a lot of information, and honestly, we can continue on for more and more in terms of this topic and the wealth of information that's able to be provided and how we can support our youth. But we had an hour today, and we want to be mindful that we certainly thank Gateway Medical Society for the partnership, and we appreciate those of you who have joined in with us for this dialogue and discussion. And we are going to plan to, for those that are in attendance, we will be sending you a small gift. So we got your address and your names when you registered, and we will send that gift. So without further ado, we're going to wrap this presentation up. Unless there's any last remarks that anybody wants to say from the panelists, we will wrap this one up. And Dante, I would remind you if you would put your contact information in the chat for Mad Dads for those that might want to get that. Barb, anything further from you?
Yeah.
Oh, thank you.
Thank you. All right, everybody. We'll take care. Enjoy the rest of your day.